So we have come to today's topic is about inspiration and insights from nursing leader. Hope everybody have been, you all been remembering what happened last month. We had a key communication skill for the nursing leader, and a lot of participants were actively participating, and they were asking a lot of questions to the CNO about how they have to be successful in the career to become a nursing leader. So today again we have a much privileged and dedicated quality person as a speaker. I will introduce you very soon, and the topic is about upholding excellence in clinical leadership through professionalism. And here again it is going to be an interactive discussion. So today Dr. Parirajan, he is not here today because he is traveling today and he will not be able to make it up on live. So we have done the recording session and the recording session of the interview part, how the nursing leader have done their role to make it professionalism throughout the clinical practice. That we have recorded, and we have in the next after some time we'll be projecting that for you all to get benefit and insights among from it. So it's here Dr. Pari Valavan Rajvelu is consultant surgeon, Sundara Medical Foundation, and he is our founder Skills for Med. And for the newcomers, I would like to say he is a great orator, quality-oriented person, and his vision is huge to upskill the nurses and to make the nurses to become a voice of the healthcare. And that's the vision is formulated as a Skills for Med. And we have the speaker who is Miss Geetha Velu. She is the Chief Nursing Officer, Billroth Hospitals, Chennai. And about Geetha ma'am, so she is a Chief Nursing Officer and NABH Nursing Excellence Coordinator in Billroth Hospital. Currently, she is working there, and her qualification is BSc Nursing in Tamil Nadu MJ University, and she have done a post-graduation and specialization, and she's pursuing PhD, and she is also awaiting for her Viva Voice, and she's pursuing MBA in Symbiosis University. Nearly 2 decades of experience professionally. I think she would be able to give us a lot of insights throughout this program. And she started her career later as a staff nurse and reached as an administrator here now. And she's a permanent membership in TNAI, Tamil Nadu Nurse Association India, and Tamil Nadu Nurse Association and Midwife Council. And also she's a member of CAHO, an NABH assessor since 2024. And she have been awarded in the national level in 2019 for the Thought Leader of the Year, and contributed to research article publication, journals, and resource person at national and internal conferences. And she is actively participating in all the training programs which is happen in the FAME portals like QCI, and then in CAHO and in AHPI. Ma'am, we are so happy and glad to have you here in this panel today.
Thank you for joining us, and despite of your very busy schedule, I heard you're having an ABH
yes, sir.
Audit going on.
Yes.
Anyway, again, welcome. It's such a pleasure to have you today. So what we are doing is actually trying to get nursing leaders like you to talk to the nurses all over India actually. So as you know, we Skills for Med, we are doing this free webinar every Friday. We've been doing it for almost the last 2 years. So there's a lot of people who attend that program, and I think we have a lot of nurses who are looking at guidance, and now we want people like you to inspire them so that they don't leave and go to other
yes,
paths. Yes. So that's the intent of having this sort of sessions. So what I'm doing is I'm actually asked the same 5 questions to almost every nursing leader. Okay. But it's surprising how we get different responses, and we want to collect all this and put it in the YouTube. I hope you don't mind. Okay, so let's start. I think let's start with your journey. Let's know what inspired you to become a nurse, and how has the path unfolded for you over the years? I mean, is it gone as expected, or you had some unexpected turns? Just take us through the journey of from where you started and where you are today.
Yes, sir. Thank you. Thank you for this opportunity, sir. I thank my management allowing me to have this such seminar. It is a great privilege to. I know already you, sir, and madam actually. For my journey, actually says it is accidental. But after joining my bachelorate degree, yes, really I learned and I came to this level actually. My journey has been deeply rewarding and as this evolving experience. Actually, I have started my career from the bedside ICU nurse. Now here in this position, I am. Definitely, the very first day till date, I'm remembering my first day of ICU. That day, actually, it is unforgettable. Actually, starting as a no voice, and I faced the stair learning this curve and emotional challenges that comes with caring for others. Actually, I was drawn the feel to desire to make some differences in others' life because when I felt by the stage where I'm here now, this 25 years of experience, I have faced so many ill and people, sick people, treated, get well. Many, since I'm ICU nurse, many have a a different thing, not unable to recover also. But though I have seen some changes, satisfaction from my care and thing. So that was the happiness, that satisfaction brought me to this level. Then I want to insist, infuse this the same experience feel to my nurses as well. That is what I'm teaching here even today. So over a time, I developed my resilience and adaptability and leadership skill through my experiences. Every experience given me a lesson actually. So the way the nursing combines compassion and knowledge has drawn my attention the most. Actually, I say it's both intellectually stimulating and emotionally fulfilling. It was. I would say definitely the nursing is a really, as others say, blessed one degree actually. So I would say my known people who ask which career I should opt, I would say yes, you can select nursing. Though it is hard,
I know.
but we can say promise that we can satisfy knowingly, unknowingly satisfy somebody's life. We can have some impact on others' life.
That is exactly true. I think I feel the same as a doctor.
Yes,
And
sir.
I think that is what sets apart these two professions from the other, professions, that people willingly, give their lives to us, and we also feel so thankful that we had the opportunity. So I think that's amazing to hear that. And no, and I also wanted to ask you, in this journey, have you had any mentors who guided and shaped your career? And I know that there could be a lot of mentors. I mean, all of us have several mentors, along the way. Is there someone or a few, at least a couple, or few of them who made a lasting impact on you? We meet several teachers, but only few of them are mentors.
Yes.
And if you can sort of share the stories or lessons that your mentors gave you, that'll be great.
Yes, sir. I too have mentors from my degree, first degree till date. But I take it this administrative position where I am today here successfully doing it. I have a three mentor. I have to mention these three mentor. I cannot say with one because I learned something from these three people. Clinically, from my senior nursing superintendent, I can name it. Shall I name them?
Yeah, sure, please.
Yeah, she's Mrs. Uma Devi. She was senior nursing superintendent. I learned a lot clinically how I can face the challenge, how can be calm under the pressure, how to handle the people, the situations. The second one, Mr. Anand, he was HR, senior HR. I learned because initially I started my career with the educator, so I learned from him a lot about training and manpower. So how to do it, the calculations, how to deployment aspects. So he learned apart from that, even he given some more training also. Then Dr. Babu, of course, he's my mentor, I would say. He has also given the decision making part, how to handle problem solving in the different situations. So these three key people, definitely they are my mentor from my past. Actually, in current organization, yes, of course there are people, but I have taken my first step based with these three people. Of course, they were on the same organization. Till date, yes, I'm taking their valuable suggestions, points. It is helping me in taking all the leadership's quality to go forward further. So I would say these three people are my mentor. Yes, sir.
Yeah, that's great. Thank you. I mean, I can also, from my experience, say that there's no single mentor, though some stand out more than the rest. And we have to be eternally grateful to our mentors for making us what we are right now. And next, let us turn to your, again, your journey. I know every career and every personal, career we face has got its ups and downs. And nursing, of course, I think has got more of those ups and downs. And can you share some of the, biggest challenges you faced, and what is that which, helped you to face those challenges or meet those challenges successfully?
Yes, sir. As you said, of course, nursing is not that easy. It is the hardest one, as like other medical degrees. The everyday the nurses are facing, it is uncertain situation, because every day the decision making is not same. It not fit for a single decision, not fit for every situation. So of course, the nurse has to be more critical, have a critical thinking, and decision making power should be yes, she should have possess that good decision making power in handling the difficult situations. As a leader, I do have a face the topmost problem challenges shortage of nursing. It is everywhere across the globally actually.
Correct.
But how to manage with this available resources without compromising quality of care, and patient safeties are in our hand. They trusted us blindly, so we are responsible for the patient and the organization as well. So the under this highest stress level, emotionally balanced, how to take care of patient care, I believe in team. So with the effective team, mentoring them, taking them together, sometime in the forward or along. So we are handling this staff shortage actually. Early in my career, I sometimes doubt myself the ability, because when I take the first time as administrative position, whether I'm capable, I'm able to handle this kind of situation, because from the training I have taken my administrative position. But having a good team besides, yes, everything is possible. So that was my success, I would say. Even in failure also, I should not do the same mistake repeatedly again. I take a lesson from it. So maybe today I can say that yes, I take even failure as a success, because I learned something from that. So barrier, yes, there will be the barrier, but every position, every category, every discipline, others, definitely there will be the barrier. But always we look for what is the we should not look at the one solution. We should think about the alternative. Definitely there will be the deficient win solution, but which may not be easily available or taken from the readily available. So we have to go for some alternate next. So by going like this, yes, we can sort it out. I mean, break the barrier as well. But overcome these barriers, seeking for supporting colleagues around, and continuous education myself, and finding the way to manage this stress through mindfulness and self care. As experts like says, every problem has answer, some alternative. So advocating the change with the system has also been important, whether it is pushing for best policy or supporting my team. So by overcoming these challenges and the barriers, we will know our true power and ability, I believe.
Great. I think you touched upon very important points. I think the first was teamwork.
Yes.
I think without teamwork and team communication, it becomes very difficult. And also, you told about facing failures as a step to success. And people tell it as a as a fad, but I think people who have gone through failures and come out of it successfully can actually talk about it, with such confidence. So, and I'm really glad, and of course, you touched upon other areas of how we can face these challenges. And nursing shortage, of course, is the biggest challenge. See, the other thing, as an outsider, see, I am a surgeon, and I look at nursing profession as though I've been trying to do a lot to empower the nurses. There is one thing I find that over the years, the nurses have been given a sort of subservient or secondary position in the hospitals, which is not true when you go to the West. So I worked 7 years in the UK, and I found how much of benefit it is for the doctors and to the patients if nurses are given equal importance, and they take a lot of roles in patient. For example, when I worked in a vascular clinic, every clinic I used to have a tissue viability nurse, and a leg ulcer nurse specialist who will be doing parallel clinics with me. That made my job so easy. So what do you think? That I think should be the change we should bring in our nursing. That's when I see nursing as a profession, I think that's the biggest challenge. Of course, shortage is there, but how do we actually bring the nurses up and from inside? Because as I said, no, you can do that much better than from the inside. I can only inspire and not try and tell about what could be done, what I've seen in the West. So what do you think is the solution to that?
Yeah, as you said, in abroad, there are some other practices, advanced nursing, independent practices. Yes, of course, India also emerging and having such. INC also have a courses on this. Yes, the shortages, the nurse in the patient side, as per the ratio, or sometimes is above the beyond that ratio. When they're managing too many things, coordinating too many works, yes, there are highest possibility of error. This will put down the image of nurse as well as the organization. So as you rightly said, we can have this kind of supporting, like independent practicing, like we have some wound care nurses. So like this, we can have some supporting nursing positions to guide them, to take them along, that they can share their work, so that the nurses at the bedside, they can concentrate more on the direct patient care, which is most important. So this are altogether the bedside nurse as supporting this kind of different designated people. There are a lot of things are emerging now. Maybe slowly we are in our organization. So we have some few medication nurse. So we have nurses. So with the support, yes, the shared responsibility can take a better quality, safe patient care in any organization. Definitely, we have to encourage taking kind of, apart from the admin nursing heads and supervisory, that's all, that directly in charges and other downline, the hierarchically. So we can have this expanded role of nursing position, definitely, which will help for the betterment of patient as well as the organization, I would say so.
Okay, thank you so much. I think we're coming to the end of this small, quick interview.
Yes, sir.
I just wanted you to tell what will be your message for the nurses out there who are aspiring to become leaders in the profession. So what is the advice you'll give them?
Yes, my advice for aspiring nurses, I would say that have some clinical experience after your degree, at least minimum 1 year. Definitely, because nursing skill is more on the hands-on training and giving a technical skill only. So have some clinical training first before you're going for any higher educations. So don't stop your education or training, updating your knowledge. Somewhat it is enough. It is not at all enough. We have to continuously get trained for updating the current societal changes, need technical changes we have to get. So we have to be good in communication, teamwork, and problem solving ability, because I would say every nurse at the bedside, no voice to the leader level, everybody are the leader or the decision maker, because are they at their level, they are doing some decision, because during the day there are people to guide and give a solution, but during the second shift, late evening or night, the nurses are left alone with the duty medical officers. There won't be any administrative head to take a decision. Definitely during that critical situation, yes, the junior most nurse also need to take a decision. To take that decision independently, of course she has to be updated clinically, even otherwise also. So don't stop your getting trained. So seek out your mentor, take a risk, and embrace opportunity now. Leadership not that easy. It is not about the title. I believe the leadership role is not raising the voice in the room. It is about how the responsibility of leadership is to create more leaders. As a CNO, I would say I truly believe that empowering my team to grow, thrive, and lead with the confidence. So leadership is not being loudest voice. So it is about bringing of other up, sharing the knowledge, developing future leader who will continue to make some differences in the patient care. So,
Thank you so much for that, Ms. Geetha.
yes.
I'm really grateful that you took this time and came in spite of your busy schedule.
Yes, I think thank you so much. The audience, everybody would have got a lot of insights from Geetha ma'am's, interview video. And ma'am, I would say my point of grasp, the key points from your title is like leave way for the upcoming leaders and equally make them to grow. And also one statement of line what you have done, which have attracted me well towards is like you have stated like you will learn from the failures and that would give you a lesson and that lesson is the way for the success. That is very a huge concept of line what you have spoken. I think many would have got many key points from your interview. Ma'am, I may request now Geetha ma'am to share your presentation.
Good afternoon, everyone. I thank this opportunity for my management allowing me to do this webinar, and I thank Dr. Pari sir and Stella for coordinating this webinar. Then I take opportunity to thank Adil sir who referred me. Today we are going to see the professionalism upholding the standard in clinical practice. Yes, already you would have seen that interview video. Few points it was discussed earlier. So today we are going to see on this 4 core objectives. At the end of the session, I hope all of you will get some insight about this professionalism in nursing clinical practice, the core principles of professionalism in nursing leadership, and to uphold ethical professional standard in clinical practice and to navigate leadership challenges. While maintaining integrity, leaders must prioritize ethical decision making, building a culture of accountability and excellence in nursing. Here in today world, with the sweeping changes, nurses are very facing a lot of challenges. They have to have provide a high quality of cost-effective care, which would almost be impossible unless they are updated, performing the high standard professional status. Professionalism in nursing, it has various things like personal characteristics, self-regulation, professional values, it's so on. So the every nurse in once they chosen the profession nursing, they have to uh, update their knowledge on their profession, and they have to create a sense of belonging and professionalism. Here, the first core principle is the core principle of professionalism is collaboration, accountability, ethics, and professional identity. It is always prioritizing the patient need. As a nurse, always from the bachelor degree, the degree when they start choosing the profession, the first thing what we learn is identify the need. Every patient is unique. So identify need individually and tailoring their care according to all the care. I mean, patient having a pain, every patient have complaint different. Pain is not same for all the patient, of course. So the problem is unique, so care also should be unique. So the nurse must identify the unique need of the patient. And the communication, second one is clear communication. So they have to listen first carefully what they are trying to say, then then we have to give the adequate information. So the second thing is communication. Then lastly, the to handle this kind of situation, attending the needs and communicating well clinically, the nurse has to have a updated knowledge. A nurse must to exhibit the knowledge. For that, the nurse has to continuously updating the clinical knowledge and skill. Here, the nurses are responsible for upholding professional and ethical standard and taking a responsibility for their actions and decision. So, providing care, it is not just mechanically. There, the nurse has to provide a care that should be fair, just, and personalized for individual needs and the patients. The nurse must create a professional identity first. How the nurse one can create a professional identity? From the nurse starting her career, she will be say that I am interested to do nursing. From that journey, she has to transit to the I am a nurse. So the process she go through from I am interested to nursing to I am a nurse. That is the professional identity, where during this process the nurse must have a lot of training, knowledge academically and demonstratively. She will learn knowledge. So the change is important. The professional identity is important. For that, the nurse leader must influence these changes. They're creating a professional identity, making the interest, the people coming into nursing, that will come from the nursing leader who demonstrate, who show as a model. So the nursing leader have a greater influence of creating a professionalism and creating a professional identity. From doing nurse, becoming a, I mean, to become a nurse, it is a most important thing. So here, so the nurse must advocating and promoting healthy environment where everyone feels safe and supported. So that is the impact has to be given by every individual nurse, where the core principle of professionalism in nursing leadership having an important role. So there are some other components in professionalism in nursing leadership, acting in the patient's interest and showing some humanism, practicing social responsibility, demonstrating sensitivity to people's culture and beliefs. So, right, there should be in the clinical bedside, there should be a right qualified registered nurse must be there in taking care of patient. That is most important, because here this gives some impact on nursing and professional identity and gives the professionalism among the society. I mean, it will give an image on nurses. So the right people at the right place, performing high standard, competent, and knowledgeable care with a high ethical standard. So ensure the safe and efficient working of nurses. Leader should provide a conducive working environment with the necessary facility. The nurse alone cannot create a standard, I mean, following a standard high ethical practice. The nurse must require few things, like the nursing leader must facilitate adequate manpower, the material, resources, equipment which is necessary to take care of patients. So the nursing leader have a greater role in making this professionalism in nursing. So the fostering the nurses' motivation to actively showcase their professional abilities and uphold professionalism in nursing. So the professionalism, how we can say professionalism is there by giving, I mean, we get the respect, the dignity, empowerment. So every nurse should possess these three things: respect, dignity, and empowerment, and opportunity to bringing up nurses' ability by the leader and upholding the professionalism in nursing. The next one is to uphold ethical professional standard in clinical practice. So to this is most important. Of course, every nursing practices procedure, what we teach people is what we I mean, what we have got training is the first thing: maintain professional ethical standard in clinical practice, nursing practice. Here there are few points: informed consent, confidentiality, competency, continuing education. So the list is goes on here. It means consistently act in a way that prioritize the patient's well-being, respect their autonomy, maintenance confidentiality, adheres to established nursing practices always, prioritizing doing good and avoiding harm. Whatever the nurse perform at the bedside to the patient, there should be always keep it in mind that avoiding harm, doing right things. Without knowing rightly, don't touch the patient. I would say that without knowing, get updated. If you're confident, then do it on the patient, because you are handling with a live human, while upholding the highest standard of conduct within the nursing by this informed consent. Now, every organization, healthcare organization have this informed consent. So we have to clearly explain the conditions, diagnosis, treatment options, what are the risk benefits, everything up to date on time. In most importantly, it should be in understandable way, whether the patient or attendant is clearly understand that what the healthcare person have explained, the nurse has explained. So after once they clearly understood, then take the consent. Sometimes the patient has one of the right have a refusal. Once you clearly explain 360-degree of explanation, then it will help the patient or attendant to take a decision making. For example, in adult patient who are mentally able to make their own decision, medical care cannot begin unless they give consent. In contrast, the minor age group cannot sign in the consent. So only the parent or legal guardian give formal consent on behalf. There are some consent violations may happen due to maybe incomplete information, maybe due to language barrier. So where there is in Tamil Nadu, if you see that bilingually, most of the information on paper it is bilingually, like English or Tamil, or it is region wise, it is vary. So we should, as a nurse, as a healthcare person, we should know that whether this language is understandable to the patient and attendant. Otherwise, we have to use the interpreter to explain clearly in their own understandable language. So then it has to be ensured that then I have to take a consent. Next, confidentiality. Of course, this is most important. Every patient in our hand, in our organization, should be protected their privacy by only sharing the relevant information with authorized individual. That is why whenever any patient get admitted in an organization, so we get the consent, general consent, where who to whom we can share the information, the primary attendant. So who will be with the patient to take a decision in case the patient is unable to take a decision. So it has to be very clearly defined on admission itself. Sometimes during a hospitalization, is there any changes in that primary attendant? So we have to have who's the first point of contact, who's the second point of contact. So we have to have that clear thing. So we cannot share the patient information to anybody, either in person or over phone, anybody gets, because without the patient consent, we cannot share their patient details to anyone. Competency and continuing education. Of course, the nurse must have a up-to-date knowledge. If according to the societal changes and technological changes, equipments, a lot of things now, it is a digital world. So the nurse has to get updated based on the changes goes. Otherwise, it is absolute. So nurse has to have a continuous training programs. Ethical decision making. So analyzing the situation through the lens of ethical principles like autonomy, beneficence, non-efficiency, and justice. Autonomy, allowed to take own choice. So when once after explaining in 360-degree understandable way, complete information, disclosure, yes, patient will take a independent decisions on their health decisions. Beneficence, to make decisions that benefit the greatest number of people. Again, normal efficiency, avoid causing harm to them. Then justice, treat people in accordance with their needs. This will help to make informed decisions by the patients. So always ethical, there will be some ethical dilemma in healthcare organization. We would see that in ICUs, emergency, when patient come critical, there will be a decision making may delay, whether withholding life-sustaining treatment from terminally ill patients. During kind of situations, always we will be having, every organization having some expert opinion, ethics committee or supervisor. They will be having a discussion and will take a decision during such. There will be ethical dilemma in every organization usually. Then open communication, of course, as like explained in the informed consent, clearly, honestly, we have to explain to the patient, explain to the patient whatever we are doing it. For example, if the nurse going and telling that you are on NPO, so the NPO means no, patient may not know it or attendant may not know it. What is NPO? So the nurse has have responsibility in explaining what is mean, that why you are keeping on this without taking any fluid or diet food. So how long it should be. So the clear open communication, because sometimes patient posted for surgery kept in NPO from 10 a.m. but the nurse has not given because she communicated with the dietitians that NPO is order given for that. Patient may not be educated, not aware of it. Food, sometimes mistakenly food may given to the patient side. Patient will take it. Due to that, the surgery may postpone. So this will, the clear, open, clear communication should be there completely. Otherwise, there will be the gap. Then it may cause patients decisions may vary. Patient decision will be affecting. So by having a open, clear communication, it will help the patient to in adherence on the treatment plan and better health management and reduce the complications. So it will give enhance the patient satisfaction as well, reducing the nursing error by minimizing the misunderstanding and misinterpretation. So it will give the build the strong therapeutic relationship as well. From the starting admission to discharge, if the all the healthcare persons to the patients having the clear, open communication will have that definitely have the therapeutic relationship. It will create the trust among us. Then professional boundaries, of course, there is a limit. Maintaining appropriate relationship with the patients, avoiding personal and financial conflict of interest. Be mindful of power dynamics and avoid any form of exploitation. Example, not disclosing the client's private health information with others. Without the consent, we cannot. We have some limitation too. Then documentation, it is most important one, of course. Every organization would face that retrospectively. If there is some issue, legal issue, when we take the case file, it has to be filled chronologically, legibly, without any missing of any single paper documents. So the accurate documentation of all patients' interactions, including assessment, interventions, and any significant changes in conditions. Ensure clear, concise documentation to maintain accountability. It is most important. Advocacy, yes, every nurse is an advocate in view of that, speaking up and reporting the concern behalf of patient and patient safety. In conditions where the nurse may be the advocating behalf of patient, escalating things to the doctor, and sometimes she is helping them to understand their discharge instruction and follow up care plan. So wherever the patient required assistance, there the nurse will be the advocating and helping the patient for better decision making and getting well. Cultural competency, cultural competence, it is a one of the thing here in the maintaining ethical professional standard. Be aware of and respect culture of differences to provide culturally sensitive care. In India now, we are receiving some international patients also. So the nurses who are going even abroad. So when we have this kind of care, patients receiving and we are going and having a clinical exposure, so the nurse must have this cultural competence. For example, here the Jehovah's, they have group of people, they will not take a blood transfusion. So the nurse, because in India there are 50 plus thousands of Jehovah's are here. So certain the blood products are not taken by this group of people. So the nurse one must understand the see nurse most of the time we concentrate on the complaints, taking care of patients. So only these physical, psychological, these needs. But the nurses should focus even the demographic data where kind of this cultural competency, the race, sex, gender specific, there is a, it is also giving some impact and has to be considered in taking care of patient. And some group of Islamic patients, sometimes they have the dietary restriction during the Ramzan period. So the nurse one has to, before ordering a meal, should have the considering their cultural beliefs. Same way, some group of people have the religion, like having that particular time of period, strict prayer will be, they will doing the prayer. So during that time, if any treatment medication has to be given, it may affect. So where the nurse cannot force. So like this, we can say many examples. So the cultural competence also the nurse must one aware on it. The next one, to navigate leadership challenges while maintaining integrity, a leader must prioritize ethical decision making. Here we have three things: ethical decision, what are the challenges, and how we can face the challenges. What are the ethical decisions are? Decision making based on the decision making based on ethics. Already we have seen in the earlier slide as evaluate the choices through ethical lens, considering potential impact on stakeholder and not just for short-term gains. So we have to follow at any point, whatever emergency or non-emergency, we have to stand and follow the ethical standard. There should be open communications, as already we said, and there should be accountability. Every nurse should have the accountability that the staffs are assigned to some number of patients as per the ratio. The nurse has to have accountability that completing their work or carrying out the order. She cannot just handing over to the next shift like that simply, but even though she can ensure that whether it is completed, because the nurse communications should not be the barrier for breaking or stopping this thing. So the nurse has to, sometimes the nurse has to admit their wrong things also, which happen because human error is quite happen. But accepting error and escalating the error on time, which will help us to take a corrective action to demonstrate the responsibility. Leading by examples. So the nurse leader must be a model so that the team will just follow that. So the nurse leader must demonstrate the behavior that you expect from your team as well, upholding the high standard of integrity in own actions. Then building a trust. So building trust is most important by how we can make a trust among the people in commonly. So that building trust will foster an environment where the individual will feel comfortable. Then they will raise the concern. There will be then only they can provide a feedback without fear of reprisal. So when nurse leader create that most acceptable kind of trust behavior among their group, it is easy that the group will feel comfortable and they will be approachable. So empathy and perspective. So empathy, perspective, and adaptability when the leader is flexible and understandable the need of the team members, then making an informed decision making that will benefit of everyone. And self-reflection. Here, the every individual from the leader and every individual as a healthcare person, nursing person, we should have analyze self where what is our gap and where we have to give more improvise where we have to improvise ourselves. So regularly assess your own actions and decision making to identify area for improvements and maintain alignment with your ethical principles. There are some challenges like pressure to deliver results, conflicting loyalty, organizational culture, difficult conversation. There are few these points will have some challenging to integrity in leadership. So how we can address these challenges by establish clear ethical guideline. So develop a code of conduct that outline expected behavior and outline consequences for violations. Then seek diverse perspective, looking for that encourage open dialogue, actively listen to different viewpoints to make well-rounded decisions and empower employees. So creating an environment where team members feel comfortable speaking up and reporting concern. There should not be punishable kind of activity when they're reporting error, whether it is done intentionally or so that we have to analyze and doing the action. Seek mentorship and guidance. Consult with trusted advisors and mentor when facing a complex ethical dilemmas. By actively where the nurse find difficulty in taking a decision, please they have to seek for their mentor, that senior person, senior nurse on duty or the supervisor on duty. If it is in the day shift, they can seek their administrative head help. So be actively managing these challenges and prioritizing integrity in all aspect of leadership. Leaders can build strong ethical teams, organization that foster trust and long-term success. The last one, that building a culture of accountability and excellence. Of course, this both are at the right and left side of thing. So here we can, without professionalism, without accountability, we cannot create a culture of professionalism here. Building a culture of accountability and excellence in nursing. Here there are list of professionalism things. Yes, communication from the down, communication, compassion, knowledge, collaboration, ethics, and presentation. It has been discussed in the previous slide. What is communication? The nurse must have a compassion that whatever she is doing, she has to have a updated knowledge. She cannot alone, cannot treat a patient. She has to collaborate with the team within the nursing unit and then the supportive other healthcare personals and following ethical standard. Of course, last the presentation in the sense dressing professionally and maintaining good personal hygiene. So all these things are important in maintaining a professionalism. Accountability in nursing, as already discussed, taking a responsibility and completing it, just not passing the things to the another person. So completing and ensuring it is completed or not. So that is taking a responsibility. Then upholding the standard, the quality, patient care outcome and standard of the professions. Being answerable. So being answerable to those who are influenced by one's nursing practice and owing your own role. So here, this professional journey, including successes and area where you may fall short. So a culture of accountability and excellence in nursing can be built by encouraging collaboration and communication. In conclusion, I would say that professional competence, self-regulation, honor, integrity, altruism, yes, respect, teamwork, responsibility, and continuous learning constitute the fundamental component of nursing professionalism. The nurse must think, act, and feel and be a nurse. The role of professionalism in clinical leadership enhances and shapes the nursing practice, fosters excellence, and strengthens leadership in healthcare. At the end, I would like to stress on that every nursing leader must encourage their team for their upliftment in all the way. I mean, all the way, like academically, if they have completed their DGNM, we can encourage them to do the post BSc and higher degree. So how can we can help them to motivate academically higher level, and how we can promote them based on their competency, not I mean following a ethical principle like doing a fair thing for the right person. So we have to encourage, create a good team in our organization. Every organization, there should be a fair decision and motivation, and wherever we have to require, we have to speak up for the team and encourage the team to come up together. So that's how we can promote the professionalism in our organization, so that the nurse team, our team, will have a belief on us. So they will trust, then they also will obey and doing things rightly in our organization. So professionalism is important. That the nurse should have that traits having a professionalism, so that has to be demonstrated in every organization. It is in the hand of the nursing leaders. Thank you.
Thank you so
Thank
much,
you,
ma'am.
Stella.
Thank you so much.
Yeah.
Thank you, everyone.